Breathing. Begin by resting calmly on the floor, taking some nice deep breaths in and out. If you need to bring your knees up and keep your feet flat on the floor, you can. Take 5 to 10 deep breaths. Lift your left knee up, grabbing with both your hands, and pull gently to your chest. Now bring your right knee to your chest and hold that stretch. With your arms out to the side, take your left leg and cross it over to the right side, reaching as far as you can with your left foot while keeping your left hand on the floor. Now we switch, bringing the right foot crossing over the left leg. Remember to try to keep the right arm as close to the floor as possible. Now we do the diaphragm stretch. Bring your knees up, feet flat on the floor, your fingers gently pressing underneath both ribs. You do not have to press too hard, but as you gently press upward underneath your ribs, then just take some deep breaths in and out into your fingers. Now we add some lumbar flattening, where we gently press our lumbars towards the floor with a gentle posterior pelvic tilt, and then an anterior tilt, lifting your lumbars off the floor and moving back and forth in another oscillation movement. The ability to do lumbar flattening, particularly to flatten the lumbars against the floor and hold it, will play a key role in some of the following exercises. The floor angel works on the thoracodorsal fascia, which is a band of fascia that connects the upper extremity to the hips. While relaxed as shown, slowly raise your arms over your head, but do not let any part of your arms lift off the floor. If your hands rise off the floor before they get completely overhead, that tells you your upper limit of tightness. Don't go beyond that right now, but slowly return your arms back to your side and keep raising your arms up to that limit, trying to go just a little bit further before your arms rise off the floor. As you raise your arm and get to the limits, you can stay there and gently oscillate or move up and down just slightly, as this will help stretch the fascia. With each gentle oscillating and moving back and forth, you can get your hands closer and closer towards each other while keeping your arms on the floor and getting yourself closer and closer so your hands can reach over your head. Don't worry if you can't do this on the first try. That's why we do fascia mobility on a regular basis. Now try the floor angel while doing lumbar flattening. That is, put your hands to your side, flatten your lumbars so that your lumbars are touching the floor, and then do the floor angel. This is another way to challenge your thoracodorsal fascia mobility. In this case, do not let your arms keep rising when your lumbars lift off the floor. Don't let your lumbars leave the floor, and don't let your arms lift off the floor either. Now we do a simple neck stretch. Place your fingers behind your head and gently stretch your neck forward. Let your pull gently stretch the posterior neck muscles. Now proceed to roll onto your right side, and we're going to be stretching the left top leg. Grab the heel and gently pull as far as the tissue will allow. Grab your right heel with your right hand and gently pull your hip backwards. Now roll onto your stomach. Keep your left arm overhead, right arm to your side. Turn your face facing to the right. Now lift your left foot in the air and try to reach it over your right leg. Reach as far as you can. If the furthest you can reach is just next to the right foot, that's okay. The goal is to eventually get your left foot to be able to reach as far across over your right side of your body as possible. Now we switch. We're going to move the right arm overhead, left arm to our side, facing to the left, and we lift our right foot up and cross it over our left leg. As you continue to reach your right foot across your body, keep your right hand touching the floor. Now we proceed to chest rises. Put your hands underneath your shoulders and push up your chest off the floor as high as you can go. Try to get as much arch in your back as you can while keeping your hips grounded on the floor. Here I'm demonstrating with my hand how my hips are barely leaving the floor as I'm pushing my chest up in the air. Now we move into upper thoracic mobilization, also called the child's pose. Keep your hands reaching as far above your head as possible while trying to get your buttocks as close to your heels as possible. Now we add a gentle head nod to the child's pose. Now we do a forearm fascial stretch. Turn your hand outwards as far as you can. Try to get your palms against the floor and gently press into your palms. Now rotate your fingers forward and we're going to move into the A frame. Raise up on your hands and toes. Push your heels towards the floor, but they should not be touching the floor. Now add a gentle bounce. pushing your heels towards the floor and then returning to the starting position. Now we get on our hands and knees and we begin lumbar flattening, but in the reverse manner, pushing our spine towards the ceiling, then lowering it to the floor. Now we proceed to left arm reaches. Take your left arm, reach it underneath your chest, reach towards the right side, and bend your head down to the floor to continue the reach. Now we have the right arm reach. Underneath your chest, bring your head to the floor and hold the stretch. Now we do coordinated crawling. Lifting your right knee and your left hand, slowly move forward, and then lift your right hand and left knee, and keep moving in this coordinated pattern for 5 or 6 steps. Now begin crawling backwards with the same coordinated movement. Continue the forward and backward crawling 5 times. Now proceed to straighten up. Put your right foot forward and keep your left knee on the floor. And keeping your back straight, gently glide forward. Keeping your back straight, gently glide forward until you meet resistance or you start to develop a small arch in your low back. At that point, you hold the stretch. Now right hip mobility, place the left foot in front, right knee on the ground, right foot slightly outward. Keeping your back straight, gently glide forward. Continue gliding forward till you feel a tightness in your hip or a slight arch in your low back. Now stand up with your left foot forward, right foot back, and we're going to rotate over the left leg and hug our hips and hold this position. Now we proceed to do individual twists where we return to neutral, then rotate over the left leg and hug the hips. Now we add body swings where we don't hold the twist, but we just return to neutral, swing over the left leg, return to neutral, swing over the left leg. Now point the toes forward, and we're going to repeat. Twist the body over the left leg and hug the hips and hold. Now we do the individual twists where we rotate over the left leg, hug the hips, then return to neutral, rotate over the left leg, hug the hips, return to neutral. Now we do body swings, rotating over the left leg, returning to neutral. Now place the left foot forward, right foot back, as if in a walking stance. And then we do hip hugs over the left leg. Now we add the individual twists. Swing over the left leg, hug the hips, return to neutral. Now we do the body swings, where we swing gently over the left leg, return to neutral. Now we switch feet, right foot forward, left foot back, and now we do hip hugs over the right leg. Then we proceed to do individual body twists over the right leg. Now we do body swings over the right leg in one continuous movement. Now spread your feet wide apart, and we'll be doing hip hugs to the right. Now we'll do body twists over the right leg. And then we proceed to do body swings over the right leg. Now reposition your feet facing towards the right. Then twist your upper body over your right leg, hugging your hips. Now add a single twist, then hold, then repeat the twist and hold. Now start swinging in one fluid movement. Now with your feet shoulder width apart, do some gentle full body swings. Now place your right foot forward and do large arm swings. Now switch to full body swings. Now pull your right hand back, left hand forward, and start do stationary walking. Swing your right foot forward, let it touch the front floor, then come on back as if you're walking. Now, can you transition to keep swinging the left leg and not have it touch the floor? Requires a lot of balance. Now, left foot forward, right foot back. Start doing large arm swings. Now transition into body swings. Now bring your left hand back, right hand forward, and as if beginning to walk, swing your right foot forward to touch the floor and bring it back. And continue to repeat this movement. Now proceed to swing the right leg without touching the floor. Now do some simple bouncing, raising your heels off the floor a few times and then rest. Raise your heels off the floor, then rest. Now do continuous heel raises, letting your arms be as loose as possible. Now proceed to doing hopping, some gentle hopping up and down continuously.